Thank you for attending and welcome to our training. Today we will cover what we are looking for in a plan of correction. And our goal today is to assist you in writing an acceptable plan of correction in the future. My name is Whitney Hart. I'm with the Community-Based Adult Services Bureau at the California Department of Aging, and I'm a plan of correction coordinator.
Thanks, Whitney. My name is Ivan Jaramillo, and I am also a plan of correction coordinator here at the Department of Aging within the CBAS Bureau. So today we will be discussing the plan of correction, and we'll look at what is a plan of correction. A plan of correction is your center's commitment to correcting any deficiencies identified by the California Department of Aging Community-Based Adult Services branch. The plan of correction is a plan of action made by the center to adhere to Medi-Cal certification requirements. The plan of correction is comprised of 5 elements, which we will go over here today. We will have examples from nursing and social work to give you a clearer idea of the kinds of things we are looking for in a plan of correction. Furthermore, the plan of correction tool is the document on which you will identify and indicate your corrections based on the 2567 report and the citations within that report. The plan of correction tool is uploaded into the Peach portal for your review and response. The plan of correction tool lists at a high level the failures based on the citations within the report and the affected participants and/or staff. Please review the Statement of Deficiencies report along with the plan of correction tool to provide you a full description of the deficiencies required to resolve.
For component A, here you will describe how the deficiency was corrected for each participant, staff, or problem identified in the Statement of Deficiencies 2567 report. Furthermore, identify the date of the correction for the deficiency, and if not yet corrected, explain why and specify a date when the deficiency will be corrected. So for every participant, staff member, or facility problem identified in the deficiency, the center needs to explain how it was corrected for those specific individuals or for that specific problem with the center. Describe how exactly the center corrected the deficiency in question, what actions did the center take to correct the deficiency, who was involved in correcting the deficiency, and we need you to submit any documentation that supports the deficiency was corrected for the participants, staff, or problem. So for evidence, for example, if the deficiency lists problems with the IPC, please submit an updated IPC for each participant listed in the report. If the participants have been discharged, please submit their discharge paperwork. If the deficiency was regarding with staff, like with training, incomplete employee files, etc., please submit any paperwork supporting that the deficiency has been corrected for those staff members. And for deficiencies regarding other problems with the center, please submit photographic evidence that the deficiency was corrected or other types of evidence such as invoices, etc. Some examples of deficiencies with the center can include not posting the activity calendar, having unsafe or uneven flooring that needs to be fixed, leaks, etc. So the next 2 slides, we will present examples. And then also please just remember to list all of the evidence submitted in component E. So next we will have a nursing example.
Thanks, Whitney. So for component A, in this example, we will be looking at a nursing citation. And the deficiency is that for participant number 1, nursing failed to liaison with the primary healthcare physician in order to obtain and or clarify a diagnosis. Now, in this example, the response is the following. On September 9th, 2020, upon discussing the deficiency with the Department of Aging survey staff, the center's nurse contacted the participant's personal health care provider to obtain information regarding the prescribed psychotropic medication. On September 10th, 2020, the participant's healthcare provider communicated that the participant is prescribed Lexapro, 10 milligrams per day, for managing their symptoms due to a generalized anxiety disorder. The liaison was logged in the center's primary healthcare physician liaison log found in the nurse's office. On September 11th, 2020, the nurse assessed the participant and information communicated by the participant healthcare physician and updated the care plan to the following: monitor for signs and symptoms for medication effectiveness 4 times a week. And if the participant shows a decline in the condition based on behavioral symptoms, the nursing staff will liaise with the personal healthcare provider to communicate these issues as needed. Lastly, the nurse entered a progress note in the participant's health record detailing the liaison and outcomes. So some things I want to discuss that came up in this response, in this example response, certain elements that plan correction coordinators expect to see and would want to see in a response are the following. One, it displays the dates when actions occurred to correct this deficiency. You'll note that throughout the response, there are 3 dates where, 1, the correction was started and initiated. 2, when the correction was communicated amongst the multidisciplinary team or interdisciplinary team. And lastly, there's a date where the correction was finalized in the care plan. Secondly, you'll note that it shows that the nursing team entered a progress note to indicate that in health record when liaison occurred, which is important, and we would want to see that in your correction. So the next slide, I will pass it back to Whitney, who will discuss social work example.
So for our social work example, the deficiency was for participants number 1 and number 2, social work failed to address progress achieved on the goals and objectives of the previous IPC and failed to indicate whether the current IPC needed revision or will continue unchanged. So to correct the deficiency, this is the center's response. The center conducted a reassessment for the participants to determine if the goals on their IPCs needed revision or will continue unchanged. Both assessments were completed on May 20th, 2021. During the reassessment, it was determined that for participant number 1, the goals will remain unchanged and documented in the reassessment. For participant number 2, the goals needed revision, which was documented in the reassessment. The center amended the participants' IPC to include the new goals. Please see the reassessments for participants number 1 and number 2, as well as the amended IPC for participant number 2. So here we have the center outlining that they did have the social workers conduct a reassessment for both participants. They needed to determine if the goals on their IPC needed revision or will continue unchanged. They gave the date that the reassessments were completed, and they also said what the outcome of those reassessments were. So for participant number 1, goals were unchanged. That was documented. And for participant number 2, goals needed revision. That was also documented in the participant's health record, and as well as they amended the participant's IPC to include those new goals. And keep in mind that IPCs can be amended. They don't only need to be updated during the reauthorization period. If there is a change in status for the participant or anything changes for them, then that care plan can and should be amended. And then next we will go over component B.
Thanks, Whitney. So for component B, you'll note on the plan of correction tool, component B asks, describe how the center corrected the deficient practice for any other participants and or staff who may have been similarly affected. Furthermore, identify the date of correction for the deficiency. If not yet corrected, explain why and specify a date when the deficiency will be corrected. In this component, a plan of correction coordinator will look for the following. What actions did the center take to determine if the deficiency affected other participants or staff? In a sense, this is your approach to determining whether the issue was a systemic problem or just a one-time off offense. So in this section, we will want to see your approach, such as an audit of all the records, a review of sample records, so on and so forth. Secondly, what did the center do to correct the deficiency for other participants? Additionally, keep in mind this component does not necessarily need to be corrected immediately. Depending on the deficiency, it could be a longer process to correct. but that plan needs to be detailed here. Additionally, in this section, some centers will indicate a change to their policy and procedure due to the citation. This response and approach is acceptable because if the citation referenced in the statement of deficiency report brought to light a systemic problem, a change in the policy and procedure is an appropriate way to respond to the component. Additionally, as a complementary action with any change to a policy and procedure, some centers indicate training. If you have amended or changed your process and policies, please train the affected staff and department referenced in the report to ensure all parties are aware of the corrections and process to move forward successfully. Centers should include evidence of a new policy and procedure and training. We will touch more on this in component E. Ultimately, the purpose of this component is for your center to show how it addressed and approached the deficiency throughout your center for participants not referenced in the statement of deficiency report, and how your center is or will work to mitigate the deficient practice in the future center-wide. So next slide, we'll take a look at example response for component B based on the nursing citation discussed earlier. The center's response for this example is, on September 15th, 2020, the program director discussed this deficiency at an MDT meeting. The program director directed all nursing staff to spot check and audit participant health records to determine if a liaison was required. The audit included not only participants with a prescribed psychiatric diagnosis, but for all medical conditions. After the audit, the nursing staff found 3 participants needed liaison with their primary healthcare physician. The nursing staff initiated liaison to clarify medications, diagnosis, and/or an out-of-range blood sugar level. On September 16th, the nurse assessed the 3 participants individually, reviewed their information received from the primary healthcare physician, and updated the care plan accordingly. The liaison was logged in the center's primary healthcare physician liaison log found in the nurse's office. Additionally, the nurse entered a progress note in the 3 participants' health records detailing the liaison and health outcomes. Lastly, the center has updated its policies and procedures to prevent the discrepancy from occurring in the future. On October 1st, 2020, the program director and the head nurse conducted a training covering the policy and procedure and discussed specific case studies and situations when liaison would be required. So some elements that I want to discuss here that were in the example. It showed when the program director addressed the deficiency amongst the team. I think that's important to note and to take credit for in your response when writing any responses for component B. Furthermore, when the program director directed the staff to determine if the issue was a one-off scenario or systemic issue, this was addressed in the first paragraph, where the program director directed staff to conduct a spot check and audit of all participant health records. Additionally, this response shows the steps taken to correct the deficient practice found through the review and how the team plans to fix it. Lastly, this response shows that there were updates to the policies and procedures and dates when the staff were trained to the new policy and procedure. So next, I'll switch the slide over to go over the social work example for component B.
Thanks, Ivan. So for the component B example with social work, the center conducted an audit on May 24th, 25th, and 26th of all 100 participant charts and found that 25 other participants were affected by this deficiency. The program director and social workers reviewed all of the files since it was possible that all participants could have been affected by this deficiency. For those participants, they were given a reassessment by the social workers. Of those, 10 participants needed their goals to be revised, so they amended their IPCs to include those new updated goals. Please see an example of one participant from our audit, their reassessment and previous IPC, and the amendment to the IPC. So here you can see that the center outlined the dates that they conducted the audit, and they did spread it out over a couple of days. Keep in mind, it doesn't need to be all done in one day. They audited all of their charts because this could have been like a center-wide deficiency. And when they found those participants that were affected by the deficiency, they were given reassessments by the social workers, and their goals were revised, amended their IPCs. And the center is also giving us an example of one participant from the audit and provided their reassessment and the previous IPC and also the amendment to the IPC. And next we will go over component C. So for component C, here you will identify the title of the person responsible for implementing the correction and the step-by-step process to ensure the deficiency is not repeated. So implementing the correction means to put it into effect. Who is going to lead the center and implement this new practice? Who is the staff member or staff members in charge of implementing the correction? Were appropriate disciplines involved in the development of the plan of correction? And here you will outline the step-by-step process, including who will implement the process that ensures the deficiency will not be repeated and how the center will implement this practice. So just some key things to remember. If it's a nursing deficiency, then someone from the nursing staff should be responsible for implementing. If it is a social work deficiency, then someone on the social work staff should be responsible for implementing. So whatever the affected discipline is, there should be somebody from that discipline leading the way, leading the correction to implement those changes. So next we will go over the nursing component.
Thanks, Whitney. The example response for the nursing citation discussed earlier is as follows. The center's POC response. The center's nursing staff is responsible for implementing the correction. Step 1, the center's registered nurse and the multidisciplinary team will closely communicate amongst each other if there are participants that may require a liaison. For example, if a participant has a new psychiatric medication, but no coinciding diagnosis, a participant's blood sugar or blood pressure is out of range, participant's memory has declined, and etc. The nurse will liaison. Overall, the nurse will liaison to obtain information, clarify orders, provide medical information, and/or clarify diagnoses. Step 2, nurses will discuss participant cases at our weekly multidisciplinary team meetings and/or amongst each other to confirm appropriate next steps to communicate or liaison medical information. Follow-up action items and next steps will be assigned and documented. Following the interdisciplinary and/or multidisciplinary meeting, the assigned nurse will contact the participant's personal health care provider via a fax or telephone and discuss updates regarding the participant change in baseline, diagnosis, clarification, and/or medication changes. The interaction and/or attempts to reach the participant healthcare provider will be documented via a progress note in the participant's chart and logged into the participant's healthcare physician liaison log kept in the nursing office, detailing when the nursing staff conducted liaison, follow-up, and outcomes occurred. Step 5, based on the update from the participant healthcare physician, the center will conduct an assessment and or reassessment of the participant's updated medical information and clarification provided by the participant's healthcare physician. Lastly, step 6, upon which the RN will care plan the needs, problems, interventions, and frequency, or etc., and ensure any updates to the care plan meet the participant's needs. So some elements I want to discuss here that make this response suffice are the following. It details and displays a tangible step-by-step process from start to finish based on the deficiency to ensure it is not repeated. It gives examples of when a liaison would occur at a minimum. It discusses how the center would ensure the info provided by the participant's healthcare physician and or vice versa, information retrieved is tracked and documented. Lastly, it talked about what the center will do with the update received from the doctor to ensure the care plan reflects the needs of the participant. Ultimately, This section should not reiterate your policy and procedure, but should show how you implement the policies and procedures discussed earlier. So next, I'll pass it back to Whitney, who will discuss this component for a social work citation.
So for the social work example for component C, here the center responded that the lead social worker is implementing the correction, and the steps the center are taking to implement the correction are: number one, the program director and lead social worker developed a social worker reassessment tool to use during reassessments. The tool has all the necessary components for the reassessments. Number two, the program director conducted an in-service for all social work staff, including progress towards goals during the reassessments, and they also went over how to use the new tool. Number three, the social worker is responsible for utilizing the social worker reassessment tool during each center participant's reassessment. Number four, the social worker uses the tool within the 30-day time frame before the expiration of the participant's current TAR period. And number five, the social worker uses the tool to assess progress achieved on the participant's goals and objectives of the previous IPC. The results of this assessment are documented on the tool and are used to inform any changes to the IPC. So here we have the program director and the lead social worker collaborated to come up with a tool that the social work team can use to ensure that they cover all of their bases, check all the boxes, have everything covered during the reassessment. And then on top of that, the program director conducted a training for all social work staff, not only about including progress toward goals during the reassessments, but they also trained on how to use the new tool. So centers can't just develop a new tool and not train on their staff on how to use it. That's a very essential component, whenever a new procedure is implemented. And so we also have social workers responsible for utilizing the tool. And then they also made sure to say that this tool will be used within the appropriate time frame when it's a TAR authorization. And then this tool is saved in the participant's record. So that is additional documentation that they have. And so next we'll go over component D.
Component D in the planner correction tool asks the following: provide a step-by-step description of how the center is monitoring to ensure the deficiency is corrected, the frequency of monitoring, and who the responsible supervisor is. For example, the administrator, program director, or someone else. One of the things we look for is who's responsible for ensuring the monitoring process is ongoing. For example, will it be the administrator, program director, and what is their approach? Will it be an audit, a sampling of charts, reviewing new hire paperwork? What is the approach to determine that the center staff have implemented the correction? Additionally, we're looking to see the frequency. At what frequency will the administrator, program director, or other responsible individual oversee the monitoring process? There needs to be a step-by-step monitoring process that the center uses to ensure that the deficiency is not repeated, to catch it before it becomes a systematic problem again and a repeat deficiency for the next recertification survey. Ultimately, this section is to ensure that there's a systematic review of the problem in question. So next, we'll look at the component D for the nursing example. In this response, we have the following: the center's program director is responsible for monitoring the implementation of this correction. Step one, the program director will review the multidisciplinary team meetings notes to determine what the team discussed and what follow-up was assigned at the end of each meeting regarding the primary healthcare physician's liaison for the participant. Next, the program director will review the primary healthcare physician liaison log weekly to ensure liaison with the primary healthcare physician occurred and health outcomes, info, and updates were communicated and determined. Next, the program director will ensure the nurse entered progress notes detailing the primary healthcare physician liaison And based on the health outcomes communicated and determined by the primary healthcare physician, the program director will confirm if the participant's care plan required an update and/or addendum. Lastly, the program director will ensure the following and oversee this correction for the next 6 months. Some elements I want to highlight that make this response suffice are: it displays a systematic approach to ensure the implementation of the correction is monitored. It gives a frequency and how long the monitoring process will occur. So I want to hand the mic back to Whitney, who will go over the social work example for component D.
Thank you, Ivan. So for the social work example, the center's plan of correction response for monitoring is number 1, when the social worker reassessment tools are completed, they are given to the program director for review by before the end of each month. Number 2, upon review, the program director approves the social worker reassessment tool and it's filed in the participant's health record. Number 3, each month, the administrator audits 10 random files chosen from participants who recently had a new IPC. Number 4, in each file, they check the social worker reassessment tool to see if it was completed in a timely manner and that the goals and objectives on the current IPC are met or needs revision. Number 5, if the goals need revision, the administrator checks the new IPC against a previous IPC to determine if goals were indeed changed. And if there is a discrepancy found, the administrator communicates this with the program director and the lead social worker, and the question of goals met or not met, and if they need revision, is revisited with the participant, and then also with the social worker. So here, we have a frequency of monitoring. So every month, how many files they will audit, 10 files, who is responsible, the administrator. And then we also have kind of like a contingency plan. If there is a discrepancy found, the administrator communicates this with the staff to ensure that it doesn't happen again. And then next we will go over component E. So component E is to submit supporting evidence that substantiates that each specific part of the deficiency was corrected. For example, in-service training, policies and procedures, pictures. The correct evidence is essential to a complete plan of correction. The files should be clearly labeled. Each citation, has 4 different components, so I've seen some centers label it for citation number 1, component A, 1A, 1B, 1C. So that's very, very clearly labeled. It's a lot easier to read and upload that way as well. And if a participant, and I had mentioned this earlier, but just to reiterate, that if a participant listed in the statement of deficiencies has been discharged from the center, in the meantime, please include their discharge paperwork and submit any relevant evidence that substantiates that the deficiency has been corrected. So evidence can include policies and procedures, assessments, IPCs, flow sheets, in-service training logs and handouts, updating staffing forms, etc. And just keep in mind that it is best to submit more evidence than less. And next, we'll go over the nursing and social work examples.
So for component E, using the nursing citation example discussed, the response for the following is as follows. Please see attached. File number 1, in-service training, materials discussed and presented on. Item number 2, policy and procedure. Item number 3 is the communication with the primary healthcare physician for the participant affected, which was participant number 1. Item number 4 is the updated care plan based on the information retrieved and assessed by the nursing team from that liaison. Item number 5 is the progress note listing when the liaison occurred and when outcomes were recorded. And item number 6 is the primary healthcare physician liaison log that details when the nursing staff communicated to and from the doctor. So next I'll pass it back to Whitney.
So for our social work evidence showing the deficiency was corrected, the center submitted the blank social worker reassessment tool, the reassessments for participants number 1 and number 2, the updated IPC for participant number 2, and the progress notes for participant number 1. The progress notes for participant number 2, the updated IPC for one participant found during the audit, and that reassessment tool for the same participant. And then they also submitted an example of a social worker reassessment tool for a participant who had a recent reassessment, and then also the in-service sign-in sheet and the handout. So we have the blank tool that was recently developed. We have the reassessments for the participants affected in the report. And then we have the updated information for participant number 2. And then they also submitted evidence that it was corrected for other participants listed in the report. And then they also gave an example of somebody who recently had a reassessment. So we could see that that implementation is going into effect. And then I'll let Ivan wrap it up.
Some additional items to keep in mind. If the department determines that the plan of correction is unacceptable or requires additional information or evidence, the center will be contacted and may be requested to submit a revised plan of correction and or additional evidence. Please put your response on the plan of correction tool and submit your responses through Peach before or by the due date in a Word format. The department will use the tool to ask additional questions or ask the center to provide more detailed information accordingly. Lastly, the center will have a new due date for the additional plan of correction responses based on the review.
So thank you everyone for attending. Here is our contact information in case you do have additional questions or comments, or if you would simply like some additional training, please don't hesitate to contact us. Thank you and have a great day.